Older women that are postmenopausal, that are no longer having periods, who develop ovarian cysts are really in a different category than premenopausal women with cysts. There's a couple reasons for that. One is that age is a risk factor for ovarian cancer. So the older you are, the more likely you are to get ovarian cancer. Now, it doesn't mean that every cyst in a postmenopausal woman is ovarian cancer, and in fact, most are not. But we're a little bit more suspicious in an older woman. The other issue is that if you're postmenopausal, your ovaries are no longer making eggs, and therefore cysts are not part of the normal function of the ovary. So in a postmenopausal woman, a cyst is always abnormal. Now, it doesn't mean that a cyst is always dangerous, but we don't see ovaries in postmenopausal women making cysts that come and go every month like we do in a premenopausal woman. So if we see a cyst in a postmenopausal woman, no matter what size it is, we have to be a lot more aggressive than we do in a premenopausal woman. And so even a small 3-4 centimeter cyst in a woman that's past the menopause is something that probably needs to be taken a lot more seriously and likely treated. First thing that we'll do is tumor markers. The blood tests are called the CA-125 and the CEA. Those are the most common tests ordered, but there are other tumor markers as well that look to make sure or at least help us get an idea whether this is likely to be an ovarian cancer or not. And then generally surgery is done. The other issue in postmenopausal women is we're a lot less concerned about preserving the ovary. In fact, there's really no need to, because the ovary isn't producing hormones anymore. And so in a postmenopausal woman with a cyst, we almost always just take the whole ovary out. And that's almost always, unless it's very large, can be done through laparoscopy, where a small hole is made in the belly button and a couple of other holes on the side with the patient asleep. And then the ovary can be removed with the laparoscope through the little holes in the tummy. That's an outpatient procedure and usually tolerated very well. So generally, with a postmenopausal woman, the size of the cyst, although important, is less important in that no matter how big that cyst is, pretty much treatment is going to be indicated.